So, why isn't every medicine just a simple pill? Let's get into the incredible science of drug delivery.
It's not random at all. There's a ton of brilliant science behind every single form. It's called the dosage form. Think of it as the high-tech package that makes a drug work for you. All right, let's break it down, starting with the two you probably see the most, solids and liquids. Believe it or not, about 80% of all medicines out there are solid forms, like tablets and capsules.
And it's easy to see why. They're super accurate, stable, and convenient. The real workhorses of medicine.
But what happens when someone just can't swallow a pill? That brings us to our next major group. That's where liquids come in. They're easier to take and absorb way faster, a lifesaver for kids or the elderly.
But sometimes you don't want medicine affecting your whole body. You need a direct hit, right?
That's the genius of semi-solids like creams. They work exactly where you put them and pretty much nowhere else.
Okay, so what if you need something even faster and more direct? You take a direct flight to the lungs.
Think about inhalers. They give you super fast relief by sending a tiny, targeted dose right to the source. So, how do doctors actually choose the right form? Well, it's a careful balancing act, for sure.
They have to consider the drug itself versus the patient's needs, like how urgently the medicine has to work. And check this out, an inhaler can work in minutes, while a patch gives slow, steady relief for hours. This really sums it up. The form isn't just a container, it's the technology that makes you better. The right form just makes a medicine safer, more effective, and a whole lot easier to take. And the science just keeps advancing, with things like smart implants and even 3D printed pills on the way.
So, the bottom line is this. The form of your medicine is just as important as the medicine itself.